Can CIS symptoms mean you have early multiple sclerosis? Imagine experiencing sudden vision problems or numbness and wondering if it's just a one-time issue or something more serious. Clinically isolated syndrome, or CIS, is a term used when someone has a first episode of neurological symptoms caused by damage to the protective covering of nerves in the central nervous system. These symptoms last at least 24 hours and can affect different parts of the brain or spinal cord. Common signs include vision issues like optic neuritis, numbness, tingling, muscle weakness, slurred speech, dizziness, bladder or bowel problems, and fatigue. CIS can be an early warning sign of multiple sclerosis, but it does not automatically mean you have the disease. It is considered a first brush with MS, but many people with CIS do not go on to develop multiple sclerosis. Studies show that about 20 to 80% of individuals with CIS eventually receive a MS diagnosis, depending on various factors. The risk of progression is higher if MRI scans reveal multiple areas of damage or lesions in the central nervous system at the time of the initial episode. Early diagnosis is very important because starting disease-modifying therapies soon after CIS can help delay or even prevent a second neurological event, which would confirm multiple sclerosis. However, not everyone with CIS will develop MS, and some symptoms might be caused by other conditions such as autoimmune diseases, vitamin deficiencies, or infections. These conditions requiring different treatments and need to be ruled out through medical evaluation. Diagnosing multiple sclerosis after a CIS event involves a combination of clinical exams, neurological assessments, MRI scans, and sometimes analysis of spinal fluid to look for evidence of demyelination or lesions in different parts of the central nervous system. Advances in MRI technology and biomarkers are making it easier to identify MS earlier and more accurately. In summary, having symptoms of CIS can mean you are at risk for developing multiple sclerosis, but it is not a definitive diagnosis. It is a warning sign that warrants careful monitoring and medical evaluation. Early intervention can be crucial in managing the disease and improving long-term outcomes. If you experience neurological symptoms lasting more than 24 hours, it is essential to consult a healthcare professional promptly to determine the cause and plan appropriate care. Remember, every person is different, and only a qualified medical provider can give you personalized advice based on your specific situation.